Many patients find that the most difficult part of treating a minor burn or abrasion is the dressing change, where traditional bandages often dry and fuse directly to the sensitive, healing tissue. This material is different. It separates from the surface below it without causing any friction, sticking, or tearing. This is Para-Gaz, a non-adherent paraffin gauze dressing manufactured by Cotton Private Limited. To begin the protocol, you need 5 specific items: your Para-Gaz dressing, sterile saline solution, clean gloves, a secondary absorbent pad, and medical tape. Having these specific materials ready ensures the application process remains sterile and the non-adherent barrier is positioned to protect the wound bed. Step 1 begins before you touch the wound. Pick up the tin or sterile pack and check the outer edges of the packaging. If you detect any punctures, tears, or broken seals, discard the dressing. The product must be completely sterile to be safe for a fresh wound. For any extra product, store the remaining packaging in a cool, dry place to maintain the consistency of the paraffin coating. Next, gently clean the wound bed using your saline solution. Once rinsed, thoroughly pat the surrounding healthy skin dry so the medical tape can adhere properly. Starting with an uncompromised package and a clean wound site provides the necessary baseline for the dressing's paraffin barrier to work. Para-Gaz is non-medicated. If your physician has prescribed any topical antiseptics or antibiotics, apply them directly to the wound bed now. Carefully peel open the wrapper, remove the gauze, and pull away any protective backing papers. Place the primary dressing flat and directly over the center of the wound. During this step, do not stretch or pull the gauze tightly across the skin. This diagram shows why. Para-Gaz uses a leno-weave open mesh grid. Pulling the material too tight distorts these square openings into closed diamonds, preventing fluid from passing through. When laid flat, the white soft paraffin coating reacts to the warmth of the wound and conforms to the tissue. Maintaining the open shape of the leno-weave creates a protective barrier that keeps the environment moist enough for cellular regeneration. Because the primary dressing is porous, wound fluid will leak through the mesh if you do not add a secondary layer. Take your dry, absorbent, sterile gauze pad and place it directly over the Para-Gaz layer. This cross-section shows the fluid path. Exudate moves up through the open mesh grid, trapped in the dense, absorbent secondary pad. Without that pad, fluid pools at the base, leading to maceration, healthy skin breaking down from prolonged moisture exposure. To finish the application, secure the edges of the secondary pad to the dry, healthy skin using medical tape or a light cohesive bandage. This 2-layer method ensures the primary layer shields the tissue, while the secondary layer handles the fluid management. The application process is now complete, resulting in a neatly secured 2-layer dressing system that covers the entire affected area. At the next scheduled dressing change, the paraffin layer will lift away from the wound bed without sticking. This lack of adhesion means that the delicate, new healing tissue is not torn open during removal. Always follow your physician's instructions regarding how often to change the dressing for your specific burn, ulcer, or abrasion. Using Para-Gaz from Cotton Private Limited provides a reliable standard for non-adherent wound care. Following this protocol replaces a potentially traumatic procedure with a controlled method that maintains a